So lucky.
So
I'm good on that.
All right. So again, I'm just showing you examples of exercises you could do. So this is one we could do if we said, you know what, he needs some lateral distraction here. Okay, we're going to work on some lateral distraction of the hip. Andy, you let me know. Yeah, you may have to do that so that we can get close to the joint line. Scoot back just a bit. With these pulleys, yeah, you all have not been introduced, but basically what you do with these pulleys is the first thing you do when you want to move them is you move this bottom one 180 degrees, so now it's free to go up and down. And then this I can pull up, I could go all the way up, I could go down, wherever I wanted with the top one. So now I get to the point where this is about the direction I want it. That's in the line of pull that I want. And then I just have to secure the bottom one. Okay? So now, and this isn't much, so I could add a little bit more weight to it. So what I can do here is give him a lateral distraction. Okay, and that's what's happening with the hip, is it's getting a lateral distraction. Another way you could use this is if he had some joint pain, you determine that it was it truly was a joint pain that he's having, and now he could go from the more flexed position of the hip to a more extended position. He can go back and forth right here to a flex and extended position of the hip. So this could be an early on exercise where we're talking about the optimal stimulus of regeneration for that tissue, where he's having trouble loading because that hip joint, the actual joint surfaces are causing pain, and now we can get some mobility of the hip. Okay? This may be where you lie him on his back, can't tolerate doing a knee to chest with a Swiss ball. Okay? It's just too much. There's too much compression on the joint, even though it doesn't seem like it's that much. This way we can unload it a little bit and allow him to get some movement. So this would be a very, very early stage exercise. Okay? Or it could be that you're here and you have him go into a little bit more hip flexion. That's close to his end range. We could just hold it there, and this could be a lateral mobilization exercise. Okay? You could justify both of those depending on how you do it, depending on how the patient presents. All right? So flip to the next slide up there, someone. Brandon?
Would that be 30 seconds maximum for distraction?
The distraction, yeah. Yeah, you could do it that way. Okay, so this one, so do we have a step over there, a stool? Okay, so she has.
Jerry, we got it.
All right.
First class.
You know what? Let's do the other one first. We'll do the one on the right first. So go ahead, stand up for me real quick. Or you know what? Actually, you can lie on your back with your head on that way. And scoot over towards your right. So here's another one I could use. For the ankle. Is there a towel somewhere that I can use this? I can use this right. And this is one actually that I use sometimes in the clinic. Feel okay on the ankle?
Yeah.
So what I want you to do is slide it out this way. Just want you to go to there and then back. What might I use this for? What tissues might I be targeting? Yeah, this is
Eccentric adductors?
Concentric as well. Yeah.
Well, he's moving it in.
No, I don't mean to be. I'm just trying to keep this sliding with him. So I would get something that slid a little bit better here. I would work on that. What could it be though?
Adductors.
Hip adduction. What else could it be?
MCL, like we were saying before.
Okay, good. So you could use it for both those purposes. Your dosing may be different, and based on that, the weight may change. What else?
IT band?
What do you mean by IT band?
Tight IT band, I don't know. I'm just thinking of something else, maybe.
So if it was a tight IT band, how's this going to help it?
Well, range of motion, I don't know.
Okay.
Just thinking.
I mean,
out loud.
it may be if you're trying to get repetitive stretching, but that typically then you'd have it on this side to where the weight is assisting. So if the resistance was assisting in that hip adduction, then I could see that. Anything else?
Feels like it's distracting a little bit.
Distracting what?
It feels like my leg's getting pulled that way, but
Okay.
maybe it's unintentional. Or I'm just
So what about if somebody's really weak in the hip abductors?
Eccentric abduction.
Not even necessarily eccentric, but it's just assisted abduction. Okay, so I've had patients that have tendinopathy in their glute med, and even just sliding supine, which is gravity eliminated, they have problems with that, and I have to set them up with some assisted hip abduction. Okay, that's the only movement that they can tolerate, and so that's the way we're using this. Their adductors are strong, so it's not overstressing those adductors, but their hip abductors are, they have a lot of, we're really working on getting rid of some of the muscle guarding, some of the tissue repair. And even with this patient, we've tried some eccentric exercises, but it's just too much, even if I put a real low load. So this is one of the exercises that we do, assisting in hip abduction. Okay, so we came up with a bunch of different functional qualities where we could use this same exercise and maybe just dose differently. Okay, flip to the next one there. Okay, so go ahead and stand up. So let's say this was my patient with those really, with the tendinopathy in that glute medius. So we may progress to, let's say, a few weeks later, and now what we're going to do, where's the other one?
Right here?
Yeah. So what I want you to do is you're going to stand here facing that way. Okay, scoot back a little bit. And put your right foot back a little bit further. Now what I want you to do is you're going to scoot back a little bit more with your right. You're just going to step out, lunge down, and then come back. Okay, so scoot back a little bit more with your right one. There we go. Okay. So there. So what's happening here?
Has to
I'm
resist
getting a valgus force.
adduction, so it's to abduct to stabilize his leg.
So first off, even without the resistance that I'm adding with the pulleys, what's the exercise that he's doing?
Lunge.
He's doing a lunge, which requires a lot of glute strength. It requires the glute medius. It requires a lot of stabilization of the glutes, some quad strength as well. And what I'm adding to this is a little bit of adduction, which it's resisted. It's pulling him into adduction, so his abductors are going to have to work even harder to stabilize. Okay, so we just did an exercise there where it was assisted abduction because those muscles were so affected, and this may be a later, like a later phase 2 type exercise that we're doing to put a little bit extra stress on those abductors to continue to work those abductors. Okay, now, how would we dose this? I mean, really, maybe it depends more on the function, but it depends what we're looking for. Are we looking for strength? Are we looking for endurance? How far advanced are those tissues? So those are all the things that are going to go into my decision on how I'm going to dose it. Okay? All right. So when you do exercises, don't think, oh, well, man, I've got to pick one of these, you know, that I showed in class. I'm just giving you examples, and there are thousands of other examples that you could come up with. Okay, and I think it's a good idea for when you practice this and you get a scenario and you're saying, okay, here are the impairments, what exercise could I do? To just think of the tissue and what ways, what could you do to stress that tissue for that particular patient.